This segment of Delmarva Life is brought to you by Tidal Health.
Yesterday, we talked about World Cancer Day, and it's used to remind people how important it is to get regular cancer screenings, even during the pandemic. Well, today we want to break that down a bit and focus on what's considered the international gold standard for detecting breast cancer early, mammograms. And to help us do that is Dr. David Seckler. He's the co-director of the Peninsula Breast Center at Tidal Health. Good afternoon, Dr. Seckler.
Hi, Lisa. Thanks for having us today.
Let's just get right to it. How important of a tool is mammography for screening breast cancer?
So it's incredibly useful. It's, as you said, the gold standard. It's our one way we have to look to see if there's anything abnormal developing within the breast tissue by imaging, mammogram. And so by taking a picture of the breast tissue, we can find things at an earlier stage. We can find things before you may feel a lump. And that's what's driven our improvement in statistics and outcomes, by finding cancers earlier. And that's the main way we accomplish that, is through x-rays of the breast tissue.
Right. So who should be getting a regular screening mammogram?
So there's various recommendations here in Salisbury with Tidal Health. We follow what's the American College of Radiology's recommendations, which is any woman over the age of, starting at age 40 and every year after, is recommended to get a mammogram every year. Some women, we start that process earlier, especially if they have a strong family history of breast cancer, in which case we might start, it's recommended to start 10 years younger than the youngest patient in the family with breast cancer. So if someone had a family member that was, say, 45 with breast cancer, we may start screening at age 35 in a family member. One place that we're seeing the loss or lack of patients getting mammograms as patients age into their 70s and 80s. They may stop getting them thinking it still may not be valuable, but in fact it is valuable. We see a fair number of patients in their 80s with breast cancer, and so we're recommending continue the process.
Why every year?
So year to year, subtle changes can occur. Again, if we wait for someone till they feel a lump in their breast, that may be that it's found at a later stage and may not have as many options as far as treatment and their survival as far as getting past the cancer. And so subtle changes can occur. Things like calcium deposits and changes in the way that breast tissue looks may clue us into the signs of an early developing breast cancer, and that can occur within a year. So from one mammogram to the next, a year apart, we will definitely see some changes, and that's what triggers us to do things like biopsies and find the cancers.
Mm-hmm. Now, have the screenings been affected by COVID?
Yeah, and I'm so glad you had us on today. It's something that we've realized locally, that there's been a tremendous drop-off in women coming to get their mammograms. Since we've opened up restrictions, we're still seeing patients reluctant to come in. Across the country, I saw statistics as high as an 80% drop-off in mammograms. And that's a huge problem, because that takes away the opportunity to find things at an earlier diagnosis, earlier stage, and could affect outcomes and survival in the future. So
obviously you're doing things differently during the pandemic.
Yeah, so we've taken great steps to make it safe for patients. Here at Tidal Health Breast Center, they have in place procedures. Patients wait in their car. You check in by phone. As soon as the room is ready, they'll call the patient in, so you're not waiting in a large waiting room with lots of patients. So masks worn throughout, hand washing throughout. All the staff members are attuned to this. The equipment is cleansed, sterilized between each patient. So all measures have been taken, and we follow all the safety standards that have been recommended. So it's safe.
Yeah, very, very important. Dr. David Seckler with Tidal Health, thank you so much for joining us this afternoon. An important message indeed.
Yeah, thank you. I appreciate you having us.